Well, very much so. An absolutely important day as the world is marking the universal health coverage. Obviously, there's a very great emphasis around making sure that there's an improvement when it comes to healthcare service delivery. And we do know in South Africa, we do have quite a number of challenges. You know, we speak about a very fragmented system. But joining us now is Minister responsible for health, Dr. Phaahla. Minister, thank you so much indeed for your time. Obviously, the big question is, can we afford the issue around the universal health coverage in South Africa? You spoke about the advancement in terms of the legislative framework when it comes to NHI. How far are we with that process?
The legislative process is fairly advanced. It's taken a long time. As indicated by the chair of the portfolio committee, we are now at the stage where the committee was just about to finalize all the consultations and also processing the nitty-gritties of the bill. We're quite positive that come the first part of next year, the National Assembly, at least that bill will be tabled in the full sitting of the National Assembly, and it will get majority support. And once that has been done, then it will go to the National Council of Provinces. As to how long that will take, it might take a few more months process, because it must also go to provinces for some public participation. And once that is done, then once the NCOP concludes that bill, then it will be finalized.
And I would imagine, Minister, you're anticipating a massive battle, because already you have some people who are taking you to court purely because of the very fragmented health system that we have in the country. What would be your message to the private sector in terms of making sure that they have a buy-in as well?
Well, fundamentally, the overriding issue should be that whether you're in business, whether you're a public servant, our overriding, priority should be the well-being of ordinary South Africans. And we are saying, as indicated by the speaker who was on virtual from the WHO, the direction in which we are going, wherein the contribution by those who have income, goes into a separate pool, which then largely funds only a few people at a very high cost. It's not sustainable. As I was indicating that, countries which have gone that route, they can't even be able to sustain when there is a major, pandemics like COVID-19. So it's going to be important that we pull all those resources in the interest of all South Africans. And we want to plead with, we know that there are a number of companies which are making good profits, but if it is really at the expense of the good health of all South Africans, I think we should really temper with that. And we believe that it is possible. We're not looking at there's no suggestion that private services should be outlawed. There's no such. But it is simply that it must be moderated to the extent that there is collaboration, such that at the end, all South Africans can be able to benefit it. And that can only be done if it's properly moderated and all resources are pulled together. And at the end, all South Africans can be able to benefit from what is available. We've got a lot of quality professionals. Health professionals of this country are being poached by very developed countries because of their skills. We've got the potential in terms of research. We've got potential in terms of even the ability, very high level, including operations and so on. But it's only afforded by a few. If we could have all that accessed by ordinary South Africans, then all of us, nobody will be left behind.
And just before we let you go, Minister, one of the speakers said this is an explicitly political issue when it comes to funding. What are you going to do as a department to make sure that you try to get that consensus?
Well, firstly, within the public funding itself, it has been raised within our own cabinet to say that even in terms of the current public funding formula, is still inadequate in terms of just making sure that we can improve the quality. But also, more than half of what is spent in South Africa in the health service, more than half, is spent only on 15% within the private sector. So we would want to, again persuade colleagues both within the public side that the health service needs better funding, but also from the money which goes into the private sector, some of which is spent very inefficiently, that we should work together in pooling all those funding resources so that we can be able to get better outcomes.
Before we let you go, Minister, we're all keenly waiting for the governing party's conference. Any expectations for you? Any nominations on the floor?
Well, those are the things which are determined by delegates at the conference. And I've been a member of the ANC, serving, at various capacities. Whether one gets elected or not elected is not a big issue. The fact of the matter is that we would wish that there's a good outcome. The people who emerge as leaders of the African National Congress are people who are prepared to serve the country, not to serve themselves, and look at the interest of the country. And we hope that that will be the dominant outcome, and so that the ANC can play its rightful role, its historic role of making sure we can focus on improving the quality of life of all South Africans.
All right, Minister, thank you so much indeed for your time. And of course, very important for the stability of the country as all the eyes will be in Nasrec. But of course, a very important issue around the issue of making sure that health service is equalized through the universal health coverage, something that is seen as a very critical instrument. Khayelihle, Khumalo, SABC News, Bosberg.